Today we're here with some tips and tricks for our front desk staff on treatment plan presentation. Let's find out how presentations that are focused on education and patient-based care can help us get the highest treatment acceptance rates possible. Remove $0 items from the treatment plan that you'll be printing for the patient. We don't want to overwhelm them with individual line items that elongate their treatment plan and don't directly correspond to an important appointment or help to explain a procedure. Phase out treatment plans by appointment as best as possible. This way patients have a clear knowledge of the amount of money they'll need at each appointment and how many visits it will take to complete treatment. Consult with a staff member who was in the room during the exam. Were there any key points of discussion? Financial trouble? Anxiety about a procedure? Possibility of a tooth condition changing? Does this mean we need to discuss sedation methods? Change the order of treatment to include number 15 root canal first? Or be ready to discuss a specific method of financing? Make notes on your treatment plan. By the time a patient gets to you, they've heard a lot. They're often still thinking about something the doctor has said, or just aren't 100% tuned into what you're saying. Plus, you might be saying a lot. I make notes on each phase that's a quick description of the services. Example, upper left filling, lower left extraction, left side periodontal therapy. Include timelines in your notes if applicable. Example, implant crown fabrication, about 4 months following implant placement. Go over what treatment was recommended and give a brief rundown of the order of treatment or any special processes or things they need to be aware of before you show them the treatment plan. The second you show the patient a plan, they have disengaged with what you're saying. Give them the important information first and make sure they don't have any questions about why they may need a certain service before you show them the money. Even though the doctor or assistant or hygienist just went over this, it's always best to make sure they understand what you're recommending and why. And it makes you and the office look good, as it shows you're all on the same page. Be prepared to explain what key treatments are, and be mindful not to use office jargon that the patient will not understand. MO composite, post and core, or phrases that devalue treatment, like deep cleaning. Do you have examples of the treatment you're recommending? Before and after photos, physical examples of crowns versus veneers, bridges and different types of implants and dentures? Seeing the difference between a traditional denture and an implant retained denture can really help show the patient what their experience will be. Be well-versed in your office's financing options, if any, and also be thoughtful of out-of-house financing options. Poor credit or no credit no longer means that a patient cannot complete the treatment they desire. The key to treatment acceptance is figuring out what a patient wants and using your resources to help them get there. Credit unions give awesome interest rates on medical loans. Loan businesses like One Main Financial allow patients to use property as collateral. When you've completed your consultation, always ask, "What questions do you have for me?" rather than, "Do you have any questions?" This forces the patient to be present in the moment and think about possible questions, rather than just saying no. Your closing statement should always be a recap of the treatment that was recommended and an invitation to schedule. This is a great opportunity to present same-day treatment or very soon options. I know we wanted to take care of the root canal on number 15 as soon as possible. Dr. Jones could complete that this afternoon if you're available. Or even for the patient who isn't sure what treatment route they're going to go yet. I know you have some thinking to do. Why don't we get you scheduled for your cleaning and we can touch base then? If your patient doesn't want to schedule anything today, it's often best to follow up the very next day to capture any questions they thought of after they left. I believe that the key to successful treatment proposal and acceptance is patient-focused care. Remember to find out what your patient wants and help them get there. Don't worry about scheduling a high dollar amount. Take care of your patient and the rest will follow.